Graceful Living is brought to you by
The aspects of who we are, body, mind, and spirit, these are the sacred parts of who we truly are. Welcome to Wellness 101. I'm Cory Quirino and this is Graceful Living. Live long, live on. Join me in celebrating life. My secrets are now yours. CMI is all about the 3 C's: care, comfort, and convenience. Within minutes you get attention, and within the day you get results. Centre Medicale Internationale is the premier experience in medical care. Found in wide, spacious, and comfortable premises while boasting advanced and sophisticated equipment, this center has assembled the most qualified of professionals and upscale facilities to meet medical expectations. They provide urgent medical care, a stress-free choice to an emergency room. Their capable urgent care physicians are always on duty during clinic hours, ready to address pressing health concerns. You can have consultation with a medical specialist of your choice on the same day you request for one. To know more about Centre Medicale Internationale, we talked to Dr. Zulig to learn about Centre Medical's treatments and services. Talk about wellness and longevity, but more importantly, let's talk about urgent care. What exactly does that mean to you, Dr. Azuiling?
Urgent care is a new concept that it's actually same as emergency room. If you go to an urgent care center, you get that same level of efficiency, urgency, complete medical services, but you want it quickly. So this is to address everyday emergencies. We have to learn in this country to differentiate between emergency and urgency. Emergency is really for life-threatening conditions, heart attack, stroke, head trauma. These are the things that have to be in the emergency room. But sometimes if it's just a fever, if it's headache, back pain, these are things that do not really require an emergency room consult.
And in the Philippines, there's no differentiation.
So people crowd the emergency room. Everybody is there for small things, for big things. And so for the people who are manning the emergency room, it makes it even more stressful. Everybody wants immediate attention, but of course, if you are the medical professional, you will assess based on how critical the condition is, and so you tend to attend more to the patients who need resuscitation, who need blood transfusion, and so the others feel left out.
So is this the reason why you put up CMI?
That is exactly the reason. I have been practicing for almost 15 years now as a neurologist in one of the big hospitals. And I see that complaint all the time. So we put up this clinic for patients to be seen urgently without having to stay 3, 4, 5 hours in the emergency room waiting to be attended by a physician.
Can you tell us more about the facilities that you have here?
We have specialized laboratories. For example, we have a neurology room where we have a video EEG, electroencephalography. So other outpatient clinics in Manila do not have that. So the EEG is used to look at people with seizures. It also looks at people with dementia. So we look at the brain activity. We also have EMG-NCV that looks at nerves and muscle disorders. Okay? We have cardiology. Cardiology, we do the stress test, the ECG, 2D echo, blood pressure monitoring, Holter monitoring. Then we have our dental suite. So the dental suite, we have our panoramic X-ray. So we have, I think, close to 24 dentists, including oral surgeons, orthopedic dentists, and pediatric dentists. And we have we have 2 suites here for dentistry. Then we have the OBGYN suite, so we can do even infertility. We have a menopause clinic, and we do the usual prenatal for pregnant women. And so, you know, if you get pregnant, you don't really want to be exposed to possible viral infection. So this is a place to have these monthly checks.
Situation of urgency can also be a situation that is also an emergency, correct?
Yeah.
Sometimes you cannot divide it or draw the line. When people come here for an urgent need or pain, what's the first thing they have to do?
They just have to walk in.
Yes.
They have to walk in. And then we have our on-duty urgent care physicians, so they can do the immediate intervention. They can do the tests, they get the tests right away. And then we can call in specialists. We have, for pain, for example, we have pain specialists, we have anesthesiologists, we have neurologists, depending on where, we have gastroenterologists, cardiologists. So these specialists are all operating on call.
Dr. Swilig, where did you get this idea? You must have been thinking about this for a very long time.
Well, I have, because I've been talking to my patients, and you know, you listen, you listen to their complaints, and you try to figure out how you can help them. And these are all their issues with the hospital.
I imagine all your patients walk out of your facility with a very big smile on their face.
Exactly. It's really been good. You know, even for us who put it up, we feel like we did something right. When you know that you thought of something that people appreciate, that really is all what you want to hear.
CMI seamlessly combines state-of-the-art equipment and personalized medical attention in a comfortable and private setting. Living a life free from sickness and worry is a goal that's within reach because you and your loved ones are worth it. We've been taught the golden rule, love yourself first. Well, here at CMI, they love you first.